This medication is prescribed for treating or preventing specific forms of bladder cancer. It works by stimulating the body's immune system. This particular form of the medication is not used for preventing tuberculosis. This medication is given through a tube into the bladder by a healthcare professional as directed by your doctor. It's usually given weekly for the first 6 weeks and then less often after that, as directed by your doctor. Before treatment, do not drink any fluids for 4 hours. The medication stays in the bladder for up to 2 hours and then is released by urinating. There may be some burning pain when you first urinate. Since the urine contains live bacteria that may infect you or others, you must sit down to urinate for 6 hours after treatment to avoid splashing. After each time you urinate during this 6-hour period, pour household bleach into the toilet, then wait 15 minutes before flushing. Always wash your hands afterward. Talk to your doctor about other important things you must do to prevent infection. After your first urination, drink plenty of fluids unless otherwise directed by your doctor. This helps clear the medication from your body. Common side effects of BCG live suspension for reconstitution include nausea, vomiting, loss of appetite, or diarrhea. If these effects persist or worsen, notify your doctor or pharmacist. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as signs of bladder irritation, muscle or joint pain, swelling or pain in the testes, unusual tiredness, fast or pounding heartbeat, shortness of breath, changes in vision, redness, swelling, or pain in the eye, sensitivity to light, severe stomach or abdominal pain, or yellowing of the skin or eyes. While a severe allergic reaction to this medication is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. These are not all the possible side effects, so if you experience any other effects, contact your doctor or pharmacist for advice. If you are in the U.S., report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report any side effects to Health Canada at 1-866-234-2345. This medication contains live bacteria that have been weakened to decrease the chances of causing an illness. However, this medication has rarely caused very serious, possibly fatal infections. Tell your doctor right away if you develop any signs of infection, such as fever that doesn't go away, chills, cough. Before receiving this medication, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to latex, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have immune system problems, have had radiation treatment, or have certain infections or diseases. During pregnancy, this medication should only be used if clearly needed, and it's recommended to avoid pregnancy while using this medication. It's also important to consult your doctor before breastfeeding while using this drug. It's important to be aware that BCG live suspension for reconstitution can interact with other medications, potentially affecting how they work and increasing your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without your doctor's approval. Some products that may interact with BCG live suspension for reconstitution include antibiotics, drugs that weaken the immune system, and mefloquine. It's also important to note that this medication may interfere with the tuberculosis skin test, potentially causing false results. If a skin test is needed, it's recommended to complete it before starting this treatment. If someone has taken too much BCG live suspension and has serious symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Be sure to attend all of your medical and laboratory appointments. Make sure to take each dose of this medication as directed. If you happen to miss a dose, be sure to consult your doctor for a new dosing schedule. This medication is not for home storage, as it is administered in a hospital or clinic setting. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.